The beds and equipment are ready, staff are being recruited. But it is perhaps a tribute to the NHS that so far no patients have arrived at the XL Centre's Nightingale Hospital. Speaking remotely from Scotland, where he's recovering from coronavirus, Prince Charles acknowledged the amazing feat of putting this all together in 9 days.
This hospital, therefore, offers us an intensely practical message of hope for those who will need it most at this time of national suffering.
And it was announced today that his mother, the Queen, will make a broadcast to the nation on Sunday evening. Across the country, other field hospitals like this are being prepared. There is an urgency now, the warning by experts that we are just 2 weeks behind Italy. Another stay-at-home message from the Prime Minister, himself still in isolation, ahead of a sunny weekend.
Everybody may be getting a bit stir-crazy, and there may be just a temptation to get out there, hang out, and start to break the regulations. And I just urge you not to do that.
The latest official figures are 3,605 deaths across the UK to 5 p.m. yesterday. Yet there are time lags in hospitals reporting these, and they don't include community deaths, so the true toll is going to be higher. The pressure is to test now, more and faster, and the Health Secretary acknowledged this yesterday, promising 100,000 a day by the end of the month.
We've now got a commitment for 100,000 a day, but we'd like the government to go even further. We want to see clear community testing and contact tracing, because that's the way in which you break the chains of transmission of this virus. That's how we can escape what could be endless cycles of lockdown. So it's good that more testing is coming online, but we need a lot more of it too.
But Matt Hancock has a way with figures. 10 days ago, he said he'd ordered 3.5 million antibody tests to see if you've had the virus. None of these so far work. Yet today, he threw out another extraordinary figure.
We have provisionally ordered 17.5 million, not 3.5 million antibody tests. But as I've been absolutely clear all along, we'll only use them if they work.
He clarified they have not paid for all of them yet. In the meantime, the government has now published a call for COVID-19 complete tests, which can range from something like this to these Samba 2, a rapid diagnostic test developed by a Cambridge University spin-out company.
The test is the size of a coffee machine. It's very easy to operate. It only takes one sample at a time, but essentially you take a swab. It's put into a fluid which inactivates the virus in 5 minutes. That is then loaded into the machine, and it's a closed system, so there's no risk of infection or aerosol. And then you get a readout at the end of it. There's a camera installed within the machine which interprets the result for you, and it's fed directly to an iPad which says positive or negative within 90 minutes.
The current PCR swab tests used on hospital patients and in these drive-through NHS staff testing stations can be highly unreliable. One frontline doctor warned by as much as 30%. Not helped, he said, by the lack of personal protection equipment or PPE, which means staff are too nervous to take proper samples from the back of the throat in case the patient coughs.
Because these tests are as good as we have at the moment, but are not perfect, and because there is this false negative rate, the reality is that this can affect the quality and safety of the care we deliver to patients. We're telling our junior staff now, if a patient looks like they're infected and they have COVID-19, then treat them as COVID-19, regardless of the swab results.
Back in this Cambridge lab, they have, however, answered the government's request for universities to help with the testing.
We've come up with a method that we've adapted so we can extract the samples more quickly, so we can improve that process. And therefore we can add a little bit more capacity by doing things with a little bit more of a quicker turnaround time.
And it is clear that the government's attitude now is that every little bit helps. Because, although it's hard to believe, it is only 30 days since the first person in the UK died from COVID-19.
Well, earlier I spoke with the government's newly appointed testing czar, Professor John Newton. I began by asking him if the government's stated target of 100,000 tests to be carried out a day is a realistic one.
It is realistic. We have some really good progress. We're using tried and tested technology. This is not innovation, it's massive industrial scale rollout of these 3 big mega labs in Milton Keynes, Manchester and Glasgow. And they're already delivering tests, many thousands of tests a day, and we're really looking forward to seeing that number go up soon.
There have been lots of different targets set. You know, the Prime Minister said 250,000 tests a day. Is that still doable in your view?
Well, the Secretary of State's target that he announced in the last couple of days is a stretching target, and it's based on the requirement for the swab tests. So we need to get the swab tests out so that we can get the most effective response to the pandemic. The requirement for very large numbers of antibody tests, I mean, we're talking there about millions of tests, that comes slightly later. So we have got a little bit of time to get the best antibody tests possible, and then those will be available in their millions.
I just want to press you on the link between the scale of deaths and the lack of testing compared to other countries. Because if you look at the UK, we've got 43 deaths per million of population from this. South Korea, just 3. Germany, just 12. Are you not concerned that the lack of speed and urgency on testing has cost lives?
I don't think you can make that. I don't think you can make that direct comparison. The situation is clearly very different in South Korea from it is here in the UK, sadly, and there must be a number of reasons for that. The availability of testing is an important component, and we used it extensively in the early days when the public health approach was very successful in containing and delaying the onset of the pandemic in the UK, and that certainly helped hugely in allowing the NHS to prepare for the rise in cases.
Just talking about the antibody test that you spoke of, the test to see if people have had the disease and are therefore immune, possibly. The UK government says it's bought 3.5 million antibody tests. Who from?
Well, the UK government has taken options on a number of tests, and it's more than that. I understand it's more than 10 million tests, the options on these tests, but that's subject to evaluating them to see if they are good enough to be used in large numbers.
So we've got options on the tests. We're not currently in possession of those tests and ready to roll them out.
Well, we have the option to use them if we want to use them. So it's the arrangement is that those tests are potentially available. If the testing had showed that they were the right test and the tests that were performed well enough for us to want to use them at large scale, then they would have been available. But in fact, the testing unfortunately showed that they didn't perform well enough. And we are working now to try and develop a test, working with manufacturers to improve the test performance.
So that none of the 10 million are currently working?
None of the tests that have been tested so far perform. They all work to some extent, but they don't perform in the UK setting as well as we would like them to.
Professor John Newton, thanks very much.
Thank you.
Well, I'm now joined by our health and social care correspondent, Victoria MacDonald. Victoria, bring us up to date.
Well, I feel like I should start by apologising because it is technically my job to work our way through these government messages and so on, but they keep throwing out these random numbers. We heard that there were going to be 3.5 million antibody tests, as you said just then, and we heard his response was 10 million. Then just an hour later in the Downing Street press conference, Matt Hancock, the health secretary, said 17.5 million antibody tests. Now let's get clear about these antibody tests. Currently, we haven't found that they work. The other thing about them is the trialling of them, I was told today, can take up to 6 months because you need to keep testing the patient all the way through for about 6 months to make sure that they have developed those antibodies. So this is a long way off. Anyway, there was some good news out of the Downing Street press conference. There are face masks, that critical issue. Do we wear them? They said, no, there is no evidence that it helps with the spread. And we know the WHO, the World Health Organization, is also looking at this, but for the moment, they're not recommending them. The other thing is there are some amazing national clinical trials going on, we were told, including using chloroquine. Now, in the Cambridge University lab that I was in earlier today, they're doing some of these trials, and they're looking quite good for the treatment of patients, as well as using some antiviral medications. They are asking for more volunteers. If anybody out there feels like doing this, they really want bigger trials, because the bigger trials, as the Health Secretary said today, the better the data.
And very sadly, we've heard today of the death of another 4 health workers, frontline workers. What is the mood among NHS staff?
You can't believe how much this impacts on the NHS staff. They feel it really personally, because there is this idea of a family. We will hear live from a hospital in East London later, and the extraordinary testament of an ICU consultant in Newport who's just recovered from the virus and is back on the front line. And we will follow a nurse who is one of those at the epicenter of the epidemic in Lombardy.
Victoria, thanks very much. Krish.
Debenhams is expected to become the latest high-profile business casualty of the coronavirus crisis. The firm, which was already in financial difficulties, is likely to go into administration next week, putting thousands of jobs at risk. And as hundreds of thousands of businesses face a funding crisis, the government has instructed banks to stop offering firms their own loans before allowing access to the government-backed scheme. Our business and global trade correspondent Paul McNamara reports.
Not long ago, this was a thriving business. Now, it's fighting for survival, in desperate need of a loan the Chancellor promised.
I've got £25,000 worth of bills stacking up to pay, and I'm still on hold to the bank trying to get a loan.
Every day for the last 8 days, Rowena has called her bank, spending up to 4.5 hours on hold. She's still waiting for a call back and a lifeline.
I am frustrated and angry at the situation. I do understand that we're all meeting challenging times, but not being able to even get through, having no information to manage my expectations for me to be able to make decisions upon at all, this is ridiculous.
This is a story that's been echoed across the nation. More than 2 weeks ago, the Chancellor announced a £350 billion economic injection, including loans to businesses. As of yesterday, fewer than 1,000 loans had been handed out, despite 130,000 inquiries. Now the scheme's been revamped. Banks can't put their own products first, and any company can now apply for the government-backed loans, not just those refused an ordinary bank loan. Banks have been banned from asking people to guarantee loans of up to £250,000 with their own houses or savings. And the scheme has been opened up to bigger firms with turnovers between £45 and £500 million. Once again, banks are in the firing line. Shops, restaurants, tens of thousands of other businesses say that they either can't get through, or when they do, they're offered the bank's loans and not the government's. The banks claim that they're trying to work as fast as they can to get this scheme up and running, and that they wanted the Chancellor to change the rules so that they had to offer the government's loans first. But once again, it's left many with a sense that when it comes to social responsibility, there is a major deficit in the one industry whose business it is to extend credit. Banks are on the side of business, they say, and cash is being distributed as fast as possible.
The fact that as of last night, £145 million has been distributed, that was up £55 million in a single day on the day before, demonstrates that we're on a curve that is moving up, and it's moving up fast and in the right direction. Of course, everybody wants their money and they want it fast. We recognise that.
I bought Kilver Court when I was running Mulberry in the mid-90s.
Here's one business hoping help is on its way soon. This designer retail outlet is owned by the man who founded the luxury fashion brand Mulberry. This week, after nearly 5 decades of business success, his loan application was turned down. The new announcements are welcome, but Roger Saul has reservations.
There will be no fixed interest, and yet the government is giving the bankers a fixed interest, I think of 1%. And again, excuse me if I've got that wrong. But the banks can still charge whatever they like.
These loans aren't just numbers on a banker's screen, says Roger. They're lifelines for millions of workers.
If they could hear... Sorry, normally I'm right on it. If they could hear Freddie, my son, who's my CEO over at Kilver Court, the conversation he had to have with one of our employees on the phone with children in the background, having to make her redundant.
Next week, the Chancellor is meeting with bank bosses to get the money moving. If businesses are to survive long enough to see the day people are finally allowed back into them, it needs to move fast.
Now, daily updates of the rising number of deaths from COVID-19 are a terrifying reminder of the message to stay at home. For the family of the youngest victim, yet more pain, as 13-year-old Ismail Mohammed Abdul Wahab's mother is forced to stay away from his funeral because 2 of his younger siblings are showing signs of having the virus. And 2 more nurses die from the virus. Our chief correspondent, Alex Thompson, has their stories.
By its own admission, the government's struggling to play catch-up regarding testing for this virus. Quite properly, NHS staff first in line at the driving test centres sprouting up in car parks across the UK. But even as they do, some are falling victim to COVID-19. They are often young and with no other apparent health issues. Arima Nasreen was just 36 and leaves 3 children. She was a staff nurse at Walsall Manor Hospital's acute medical unit.
It's something, as the chief nursing officer, head of my profession, I would never have wanted to talk about at all. A very talented nurse, a very loving mother, and today we are very sad to see a loss of one of my professional colleagues.
She was awarded just last year for her outstanding contribution to equality, diversity and inclusion in health and social care. Arima died in intensive care on a ventilator in the early hours of this morning. In a social media post, her friend Ruby described her as the loveliest person you could meet, who went above and beyond for everyone she met. It's believed that Arima did not contract the virus at her work. Also, a mother of 3, 39-year-old nurse Amy O'Rourke died last night at the Queen Elizabeth Hospital in Margate, where she worked, again in the acute medical unit. The chief nurse at East Kent Hospitals praised her commitment to both patients and colleagues.
There's a lot of growing evidence to suggest that obviously the more kind of viral load you get, the closer you are to people, the more that they will be kind of depositing the virus over you, and that's absolutely where nurses are all the time. They are very close to people, delivering care, and that contact is unavoidable in nursing.
We don't know what problems, if any, either of these nurses encountered with any lack of protective equipment, but the Royal College of Nursing says this remains a serious problem.
The fact remains that the supply line has got to improve, and ensuring that that supply line is consistent over a period of time, because the kit will be used a lot. Obviously, it will be in high demand.
On Monday, the virus claimed its youngest UK victim, 13-year-old Ismail Mohammed Abdul Wahab, at this London hospital. 2 of his siblings have since developed symptoms, so that means his mother was barred from her son's funeral today, just as his illness meant she couldn't visit him on his deathbed in hospital. And in the past 2 hours, the government has announced 2 carers have also died today. They gave no further details, leaving the chief nursing officer to express concern that these deaths will not be the last of frontline NHS staff.
I worry that there's going to be more, and I want to honour them today and recognise their service.
So as the death rate from the virus gets worse before getting better, as it assuredly is doing, the hazard of delivering frontline acute medicine will be tragically clear as we continue to lose those committed to looking after us.
Well, now from a hospital in East London, we're joined by Dr. Amica Okorocha, A&E doctor, and his colleagues. Doctor, how are you all feeling today as more of your colleagues are lost to this virus?
That's a very good question. It's obviously, while the news progresses, it puts us in a very, very difficult situation, because I'm speaking on myself and on behalf of my colleagues. It's very, very difficult coming into work, knowing that you want to do the best for your patients, but knowing you're putting yourself and your family at risk. And I think that's something that we're all dealing with at the moment, and we're all trying to kind of process exactly what's going on. It's almost like we're in an internal kind of ethical debate about what the risks are to ourselves now, as well as our patients, and it's quite a difficult time for us.
Is it frightening going into work now?
Honestly, I really want to tell you that we're carrying on smiling and going into work as normal, but I feel like I'd be lying, and I wouldn't be representing exactly what we're all really feeling. you can tell there's a palpable type of anxiety amongst all of us as we hear these stories of our colleagues nationwide falling victim to this illness. We do feel frightened for ourselves and our families, and you can see that we're taking extra measures to make sure that we are protected and our patients are protected too, because I am human like the rest of my colleagues, and we do worry. At times we do worry, could this be us next? And it's not something you really want to think about when your main goal is to be thinking about the patient in front of you.
And what is the situation for your patients?
Sorry, say that again, please.
What is the situation for your patients on the ward?
So for our patients on the ward, it's kind of how it's been for the last number of days. We're seeing more and more patients come in. We're getting tested patients more and more. We're seeing more positive cases. We've had a few that I've had to actually pronounce today, unfortunately. And it's another scenario where it's so difficult to speak with the patients and their families, obviously because we know that their families can't come in and have the chats that we normally have on the ward. We can't have the chats with the patients in the manner that we normally have them with them on the ward. And this makes everything a lot more difficult. Patients are very worried about if they're positive or not. Families are very worried about if their parents and siblings are positive or not. And it's something we're going to have to go through every day, unfortunately.
And if the statistics are correct, the expectation has to be that there will be more cases and many more deaths in the coming days. Do you feel in your hospital that you are able to cope with that rise?
I feel that this is something that many of us actually have predicted. Obviously, we're on the front line seeing these patients every day, so we get an accurate number of just how many we collect in, just how many test positive. So I think mentally it's something that we've checked into, as in, okay, this is what the scenario is going to be. We're going to have to find a way to handle it. We are the NHS, we are a resilient system, and we will get through this. But at the same time, we're thinking, do we have enough supplies to cope with this? Mentally, will we get through this? Will we have enough beds? Will we have enough ventilators? What will the escalation plans be? What will we do with the families of these people? It's something that does go through all our minds every day. And we're just hoping and praying for the best at this moment.
Thank you very much.
Thank you.
Thank you very much indeed for everything you're doing and for talking to us tonight. Now, cases and deaths from COVID-19 are continuing to rise alarmingly in the United States, with New York State alone reporting over 560 fatalities in one day. The Centre for Disease Control is expected to suggest all Americans wear a mask outside. Yet healthcare workers are still saying they don't have enough personal protective equipment. Our Washington correspondent Siobhan Kennedy reports.
This is not the back of a supermarket depot. These are not delivery trucks. They're parked outside Bellevue Hospital in New York, and they're waiting for the dead. The refrigerated lorries can hold as many as 3,600 bodies. They say they don't need them now. The city's morgue's not yet full, but it may not be long.
New York is in crisis. Help New York.
It's a matter of days before New York runs out of life-saving ventilators. The governor today saying he's signed an executive order to force private hospitals in his state to immediately hand over their spares.
I'm not going to let people die because we didn't redistribute ventilators. The National Guard are going to be deployed to pick up these ventilators, which are all across the state, and deploy them to places where we need them.
It's not just ventilators. As the number of infections soar, medics on the front line are running out of the protective gear they need to stay safe.
We are demanding that we get all the hoarded supplies that exist of PPE so that we can protect ourselves, our families. We can't do it if we're dead.
President Trump says they're doing all they can, but no one seems to believe him. Not even his favourite American football team, the New England Patriots, which sent its own jet to collect 1.7 million masks from China to give to New York. It was having to wear the same mask for a week that Dr. Frank Gabrin in New York believed led him to contract the coronavirus.
He said it was me using the same mask for 4 days in a row that infected me. And he said the timing perfectly correlates with me developing symptoms in 9 to 10 days. He said, prepare, it's coming to you.
His best friend Deborah said she spoke to him on Sunday the 28th of March when he was at home, isolating with his husband who'd also contracted the virus. Then on Tuesday morning, just 3 days later, Frank's husband called.
Put me on speaker, and we both were talking to Frank, trying to get him to move, to do anything, to try to get his lungs moving, to try to get air in him. And while we waited for the paramedics to arrive, it took about a half an hour, and his breathing got more labored until it was practically not happening when the paramedics came in. Immediately started CPR, and it happened that fast. It was not him labored breathing. It was nothing. Within 2 hours, they had pronounced him gone.
Essentially, what you're telling me is that you had to listen to your best friend dying. I mean, how impossible was that? And you were on the phone and there was nothing you could do. I'm so sorry.
You know, it was horrible, and I am much better today because I am passionate and fighting because I know what he wanted.
What Dr. Frank wanted was for all medics to have the right equipment and for people to stay at home to ease the pressure. Yet today, America, the world's richest economy, is scrambling to secure enough masks while the president refuses to order a national lockdown.